check in with our medical professionals every Tuesday at this time. Brought to you by Independence Health System Expert Care here. And this morning, the medical director of the Cardiac Catheterization Lab is Dr. Brian Carey. Doc, good morning.
Good morning.
This has been, I think, an eye-opener for me in the past month talking about heart issues. And for those that don't know, it's the number one issue, right, for men and women, correct?
That's correct. Still the number one cause of mortality in our country.
Well, let's talk about interventional cardiology, because I know your cath lab has some milestones, and you performed the first, and hopefully I'm saying this right, pulmonary help me out.
Embolectomy.
Thank you. What is that?
So that's when we suck a blood clot out of your lung artery. Traditionally, when you had a blood clot in your lung artery, we could give you blood thinners to keep it from getting any bigger. And if it was really severe and immediately life-threatening, we gave you blood clot melting medicines. But those medicines come with potential for bleeding and significant side effects, so we really reserved that for only the sickest patients. We now have a big catheter we can put in there and suck the clots out. We call it a whoosh. It takes about a second once we activate it, and it just sucks the clot out without the potential for bleeding that you have when you use the very strong blood thinner. So it's a safer procedure and less invasive. And we did our first in Butler within the last month.
Yeah, and it's called the Inari Medical Flow Retriever System, and it sounds like this is a game-changing development.
It really is. Yeah, it's technology that's been around for a few years, but it is changing the game for blood clot in the lung, which is, next to heart attack, it's always the number two thing when patients are having chest pain and shortness of breath that can be immediately life-threatening. So it's very common, and it really gives us the opportunity to treat people more safely, more completely, and get them back to work and their usual quality of life quicker. So it is an exciting thing to have available to our patients up in Butler.
And some of the other things in your toolbox is an Impella device. What is that?
So an Impella device is, we have two new developments in the cardiogenic shock treatment. One is a right-sided Impella device. Traditionally, we focus so much on the left side of the heart in cardiology, and we sort of consider the right side the evil stepchild that belongs to the lung doctors. But we've learned in the last 10 or 15 years that ignoring the right heart often is a disservice to our patients. And we now have access to use an artificial heart pump when the right side of the heart is failing. Even some patients, when their left side of their heart's functioning quite well, still are doing poorly. And we can put in through a vein in the groin a pump that can do the work of the right side of the heart, of circulating blood from the right side of the heart to the lung to get oxygenated. And we had our first case very recently of a patient who the left side of the heart was working great, but the right heart was failing, and we were able to use this device to support her through her heart attack and the recovery afterwards.
We're with Dr. Brian Carey, Medical Director of the Cardiac Catheterization Lab, in this case with the Independence Health System in the Butler area. What is the Vital Flow ECMO system?
So the ECMO system is, again, for patients who have biventricular failure, so their heart is really, they're doing extremely poorly, and they're not expected to make it. We can now put them on the ECMO system, which really does basically the entire work of the heart, so that we're able to remove blood from the right side of the heart, oxygenate it in a machine, and then return it to the left side circulation to go to the rest of the body. So patients in cardiac arrest can benefit from this if they can't be immediately resuscitated, or patients whose other organs are still functioning but their heart is failing can be put on the ECMO. Some of them will recover with time. Some of them will be considered for transplant or more permanent artificial heart pumps. And we recently upgraded our technology in Butler so that we have the state-of-the-art ECMO system available to our team.
And as I understand, the first dual leadless pacemaker, a lot of people have heard about pacemakers, they want them to be as minimally invasive as possible. How does this function?
The leadless traditionally a pacemaker has a battery that goes right underneath your collarbone and sticks out, and then has two wires that attach to that battery and go down into your heart. The leadless pacemaker skips the battery and just sits in the chambers of the heart, and it's traditionally been used in patients who are felt to be high risk for infections predominantly and for other reasons with a traditional pacemaker. And it used to be the availability of the leadless pacemaker was solely a single lead, which doesn't have some of the some of the benefits of a two-lead pacemaker. So they now upgraded that technology where you can get one of these leadless pacemakers that has all the bells and whistles that a normal traditional pacemaker would have without some of the risk of infection and some of the other things. So that's an up and coming, and we did our first up in Butler very recently.
And finally, a next generation treatment for AFib. First, Doc, explain what AFib is and what an ablation does.
Sure. AFib is the irregular heartbeat, and often makes patients' heartbeat very fast, and so it's very uncomfortable. An ablation is a curative treatment for AFib, where the doc goes into the source of where the short circuit that's causing the irregular rapid heartbeat comes from, and just does a controlled, traditionally either freeze or burn, and just breaks that circuit. And the pulse field ablation is a new, more accurate way of going in and doing that. It's reduced the procedure times for the AFib ablation. Traditionally, AFib ablation was a long, drawn-out procedure, took a lot of cath lab time, and we know the longer the procedure takes, there's always more opportunity for complications. And with this new pulse field ablation, our electrical partners have reduced the procedure times by 37% with enhanced accuracy and efficacy. So it's another exciting new development that we have available to our patients in Butler.
Many cath lab milestones, and we appreciate Dr. Brian Carey, Medical Director of the Cardiac Catheterization Lab, part of the Independence Health System expert care here. Doc, thanks. Fascinating. And I'm excited that you have so many innovations that you're utilizing now, all game changers, right?
All game changers, yep. Exciting to be back and making progress.
That said,
Thanks,
we need to exercise more, right? So sunshine, get out and do it. Thanks, Doc.
That's right. Prevention. All right.
All
Thanks,
right.
Larry.
Great information from the